Hi, my name is Jay Fishman. I'm a professor of medicine at Harvard Medical School and head of the Transplant Infectious Disease program at Massachusetts General Hospital in Boston. I'm here with Wayne Hawthorne to talk about the upcoming exciting TTS meeting in Sydney, Australia. Wayne, tell us a little bit about yourself.
G'day. Welcome to Australia and Sydney, where the 2026 TTS meeting is going to be held. We'd like to welcome you to our fabulous country and sure you're going to have a great time. My name's Professor Wayne Hawthorne. I'm Professor of Transplantation at Westmead Hospital, University of Sydney, and I'm the immediate past president of the International Xenotransplant Association, current treasurer and secretary of the IXA. And we'd love to welcome you here to Sydney.
So this is part of the big picture. So when you hear making xenotransplantation work for humanity, this is the title of the session that we prepared, right? What does success look like to you?
Um, I guess what we're aiming for is long-term success, and islet cells give us that capacity. Why? Because we can actually scale them up. We can give transplants and multiple transplants to our patients. So we can start with an initial smaller dose, which may well be safer, and then top them up to be readily hypoglycemic treated patients to end up off of all exogenous insulin. So it's scalable, safe, and efficacious.
So, Wayne, what needs to go right scientifically and clinically for the field of xenotransplantation to actually deliver on the real world promise you've discussed?
I guess we need to start with measurable outcomes, and I guess insulins gives us that capacity. Um, Islets, we can actually treat the patients, as I said, stepwise, and we can measure the insulin independence. We can look at the hypoglycemic burden, hemoglobin A1C, and porcine C peptide levels. And in time, these patients can benefit, and we can potentially benefit a greater number of patients. The things that need to go right to be able to do that is to be able to get the appropriate animals, the appropriate transgenes to transplant these patients. And we've already basically lined these up for the different organs, tissues, and cells. We feel that with islet cells, we've got the capacity with the current pig lines to be able to transplant those patients. But the other things that have to also align are things such as the guidance, the regulations, and the capacity to modulate the immune system with the various immunosuppressives. That's another thing that islets also have great capacity to do, and we've been able to achieve to date. Islet cells that express their own immunosuppression. So we feel that hopefully, with all these things aligning, the planets are aligning, the pigs and cells and the outcomes will align too.
So, Wayne, as you know, I'm president of the International Xenotransplant Association, and you're currently secretary treasurer. And really, in our role in IXA, the question ties into how are we going to implement xenotransplantation worldwide and how international collaboration is going to accelerate that progress, and how particularly the global community can and will align on standards and evidence surrounding xenotransplantation. You and I have both been involved in this, both at IXA and with the World Health Organization. Why don't you give us your impressions?
That's a great question. I think it's something that the IXA TTS have been working in combination with the WHO for not just a few years, but many, many decades. We've had numerous communiques and development of guidance and various standards that have been used by the various organizations within the various countries to set their standards for transplantation and xenotransplantation. So we've worked very closely with all of those organisations to get a universal set of guidance documents. The IXA we've published in conjunction with TTS and WHO over the years, 4 guidances, but also we have a large number of white papers that again, we've recently published quite a number, both in xenotransplantation, TTS, and a number of other worldwide publications.
So we're coming up to the TTS Congress in Sydney, and tell us a little bit about the papers you're excited about. Of course, there's a lot of papers on xenotransplantation, but there's a lot of things on general and specific immunology of transplantation. What is it that excites you about what we're about to see in Sydney?
I think we don't just want people to submit abstracts on xenotransplantation. There's so many new avenues, especially things like organ regeneration, machine perfusion, now coming into xenotransplantation. I'm hoping we'll see quite a number of new models and methods for machine perfusion in conjunction with things such as liver hepatocytes for bridging the gap in patients. New ventures with development of various cell lines that can be put into these devices would be really exciting to see. Also, organ preservation. If we're going to ship organs, tissues, and cells equitably, globally, to allow people to be transplanted, we want to see what new technologies are capable of doing this. So we'd love to see some abstracts around these areas as well.
So, Wayne, we're all excited about coming to Sydney and to Australia, and maybe you can tell us a little bit about the venue that we're going to, which is apparently a brand new, exciting venue for our meeting, and the other things we're likely to see or perhaps unlikely to see when we come to Australia.
That's a great question as well. Obviously, you hear a lot about the spiders, snakes, sharks, box jellyfish, crocodiles, all these wonderful animals that we just love and adore here in Australia. If you come, hopefully you can get to see some of them, but maybe you can actually enjoy the beaches or some of the sites. Australia is a huge continent that is as big as the US. In fact, it's bigger. It has some astounding sights, and you can see so much traveling around. So take some time, come spend a few weeks while you're here. If you can't, there's also some fantastic things to do around the Sydney Harbour, including getting to see some of these animals in the zoo, in the aquarium, fabulous things to do. So welcome here to Australia and Sydney.
I'd like to thank Wayne Hawthorne, and I am looking forward to visiting Sydney and to a terrific meeting in Sydney. Thanks very much.